and we're to discuss the radiation waste event that occurred in Goiania, Brazil in 1987. The objectives of our discussion are to examine the cause of this accident and establish a chronology of events, discuss the public health response from authorities, and analyze human and environmental health impacts contextualizing the similar events in history. Here's our table of contents. This was a localized radiological accident that took place in 1987 involving the mishandling of a radioactive canister containing cesium chloride, otherwise known as cesium-137. This image on the right is the International Nuclear Radiological Event Scale established in 1990 by the International Atomic Energy Agency, and it labeled this event a level 5 accident, which signifies an accident with wider consequences. So what is cesium-137 and why is it dangerous? Here we see a profile of this radioactive contaminant. Its chemical properties: liquid at room temperature, but bonds with chlorides are from a crystalline powder. Its modes of contact are from ingestion and inhalation. The key risks are burns, acute radiation sickness, cancer, and even death. On September 13, 1987, a canister containing this radioactive cesium-137 was taken from a radiotherapy unit in an abandoned clinic in Goiania, Brazil. On the right, you see a diagram of the canister, the logo of the hospital, and an image to depict this event. In the following week, the iridium capsule was opened in an attempt to dismantle the canister, but a blue light was emitted, which was the crystalline cesium-137. Afterward, it was distributed from the scrapyard to a family household where symptoms of nausea, vomiting, diarrhea, skin burns, and even deaths were reported. This map allows us to visualize the locality of this event, which took place in a small region, in a small city, in a small community within that city, which created ripples throughout the entire country and the world. This figure allows us to visualize the mechanism through which this cesium-137 was distributed and through which exposures were increased throughout the community. It wasn't until September 28, 1987, when the source was identified and the government response was initiated. This was a three-pronged approach, starting with evacuation and treatment, where over 100,000 people were screened for radiation. Then there were over 3,500 cubic meters of radioactive waste that were broken down and stored in a concrete line drums at a nuclear facility. And lastly, to address this issue at the root, new regulation needed to be implemented for proper control, transportation, storage, and disposal of the radioactive material. There were negligence lawsuits and investigations as well. In the short term, there were 249 confirmed cases of this significant radiation. Over 130,000 were affected because of screenings and also because of being displaced from their homes. In this figure here, we see the distribution of symptoms among the 249 people. Most of them were low-level contamination, but there were still cases of moderate symptoms such as nausea, vomiting, and dizziness, as well as severe burns and deaths. Comparing the short-term effects of this event to other well-known events such as Chernobyl, Fukushima, Tokimura, and the storage tank in Kishtim, it is a very low death toll compared to those. However, the radiation level of 6 sieverts was still highly significant, however, not as much as that of Chernobyl or Tokimura. In the long term, breast cancer incidence in Guyana saw a sharp increase after a decade and has since stabilized. So the human health effects of this event still persisted, as you saw an increase from 1988 to 2004 in the incidence of breast cancer. And as we established before, cesium-137 is associated with an elevated risk of cancer. The mortality related to this event also increased, and there has been a psychological effect on the community known as radiophobia, which is the fear of radioactive contamination. And it began to impact social stigmas and practices in the community. For environmental health impacts in the short term, the cesium had leaked into the soil so that large amounts of dirt need to be removed and contaminated buildings need to be uprooted and demolished, which left the community in a state of ruin such as this. And also in 1999, the study was conducted that showed that high values of cesium-137 still remained in soil layers at depths between 10 centimeters and 40 centimeters from the surface. And this figure shows, in addition to the environmental effects of the cleanup efforts, there was a high expenditure spent on this. It costed Brazil $1 billion to clean this up. However, it still doesn't compare to some of the other major events in world history. However, considering the locality of this event, $1 billion equivalent is still highly significant for this community. So, lessons learned. The radiation waste event in Goiania, Brazil was an avoidable incident that resulted from negligence of an abandoned hospital and the mishandling of a canister containing cesium-137. This crisis persisted for about 15 days before a government response was initiated, and the intervention from the Brazilian government and the IAEA included evacuation, decontamination, and regulation of radioactive material. Previous policies and practices were amended, and lawsuits were served on the basis of negligence. While the death toll and cost of this accident is relatively small compared to other accidents, the radiation waste of cesium-137 was devastating in a localized event, and the human and environmental impacts have been felt decades after. Thank you for watching.